Hello, hello. My name is Hope Ludwig, and I will be doing a presentation on communicating as a healthcare manager because I think it is the heart of healthcare. If patients are the heart of healthcare, then communication is really just the forefront of that. So let's get right into it. What is communication? As a healthcare manager, using clear language to communicate guidelines and procedures is a must. Your staff also requires the information to clearly communicate to patients about treatments, finances, plan of care, and any patient worries that arise. So, importance: inspires effective teamwork, promotes connection, encourages collaboration, nurtures teamwork. Good relationship builds with your patient, implores vital health information, helps avoid errors. Um, what makes a good communicator in healthcare? Understanding what is most significant to the individual. Patients should feel any worries are perceived and regarded, and addresses every patient with the purpose to understand the patient's distresses, understandings, and feelings. Common issues with communication: use of jargon, so using technical phrases to make communicating more challenging to be understood by someone with a different field of experience, and information overkill, so overload of information can push the most important parts to the back burner. Cultural differences: biased ideas about how to treat people because their race, ethnicity, and other aspects can cripple communication, and language barriers, of course, impact a patient's understanding of their circumstances or treatment. Unclear information: managers who don't focus on delivering one clear message to all their staff risk confusion, frustration, and lack of trust. Imposter syndrome: healthcare worker doubting their choices about care, might be unwilling to defend their ideas about treatment to providers, and this can, of course, affect patient care. So, effects of poor communication between management and employee: miscommunication about patients' data and lack of communication of patients' information can lead to unfitting conclusions, and treatment can be interrupted because of the seriousness not being understood. Why this happens: so due to unsuccessful guidelines and measures, language barriers, lack of communication skills, workload burden, inadequate documentation, and staff member conflict, unproductive communication in organizations in the hospital as well. Effects between healthcare worker and patient can result in mistakes about medications, confusion on follow-up instructions, this leading to poor results in readmissions, and insufficient informed consent can lead to malpractice lawsuits. Why this happens: most patients don't have extensive knowledge on medical terms or procedures and healing matters. It can often be a lot of information for the patient all at once. Difficulty with report building, language and cultural barriers, and time management issues. So solving these: asking for feedback about ways to improve your care and ideas for treatment. Translation help: translators and interpreters are just like the standard care that we can give. Including all staff to ensure that everyone is on the same page and getting the same information. Showing respect, so good manners and patients, or good manners to patients and staff. Overcoming bias by understanding the gratitude for others and individuals and accepting differences among patients and your colleagues is super, super important. Effective communication in your organization's mandatory training program. So implementing this as just a mandatory training, and make communication a part of your organization's culture, just leading by example. Being a positive role model can help employees do the same. A statistic that I found was that during a 10-year period had demonstrated that ineffective team communication is the root cause for nearly 66% of all medical errors during that period. So team members not communicating effectively can affect the patient as well and really harm them. Another one was a current research indicates that ineffective communication among health team professionals is one of the leading causes of medical errors and patient harm. So again, if patient care is the forefront of healthcare, communication is really in front of that. Benefits to effective communication: decreased risk of patient complaints, improved patient perception of clinicians' capabilities, trust, and improved patient compliance and adherence to their care. Improves capability of clinicians to attain medical histories, enhanced emotional health of your patients, reduced time spent during follow-ups and discussions, better job fulfillment, so less work tension and stress, and less burnout for healthcare managers. Conclusion and final thoughts: there's many ways to effectively communicate as a healthcare manager to patients and employees, and many benefits as well. It's really endless. We can assist our team by being more upfront with our employees. Effective communication is limitless for everyone, and these are my references. So thank you so very much, and I hope that you got something out of this, and that's all for now. Thank you so much.